My name is Joyce. I have Coco, who will be 7, and I have Sugar, who will be 22. My husband and I both lost our jobs, and my Social Security wasn't enough to pay the rent, so we ended up in storage for a while, and then in the van. And after 2 weeks in the van, I had enough. I said, I can't take it. I'm 66, so it, it took a toll.
A lot of times when people are unhoused and they go to a shelter, if the shelter will not take their pet, they will not go in the shelter. Name is Lori Morton Fiesel, and I'm the program manager of animal control licensing and vital records. And I work for PHPP in San Mateo Health. In 2016, I began talking with Dr. Julia Lewis. She's one of the veterinarians that works for me. And we realized that there was a need, that a lot of people that were unhoused or homeless and lower income couldn't afford veterinary care, and they were having to surrender their animals to the Humane Society. And so we thought, how can we fill that gap? And we created the Vet Wellness Program, and providing vaccines, flea treatment, antibiotics if needed, some other medications. For instance, like if a dog has a heart condition, Dr. Lewis can prescribe heart medications.
Well, they keep mine up to date on all shots. Um, they check their teeth. Coco had to have a couple pulled.
The veterinary makes sure that they're all up to date on everything. It's awesome. People that can't afford it, like me or him, you know, they wouldn't know what to do. It helps tremendously. People just don't understand.
I'm Dr. Julia Lewis. I'm a veterinarian and I also have a degree in public health. Having pets means, uh, for some of the clients I've heard, that's their one living being that they know has their back and is always there for them. There's a concept in medicine called One Health. And so basically, it's recognizing that human health, animal health, and environmental health are all interrelated. That the health of one or the um, lack of health of one affects the other two intricately. So we're trying to bring that concept to our services here.
And Miss Julia, she's great. She just talks to them and then gives them a treat.
Without the grants, we really couldn't run this program. And UC Davis, the Maddie's Fund, have given us grants to provide even more service. We don't have the ability to do dentistries or surgeries, and we've had animals that have needed to have tumors removed, x-rays, or might have a severe skin condition. By contracting with the veterinarians and getting the grants from, like, for instance, UC Davis, we're able to provide that care. And what that does is the owner of the animal doesn't have to surrender their dog.
If I get upset or frustrated, I just go in my room and be with them and cuddle with them. They're really good about that. They love to cuddle. I used to drink. I am now a year and almost 3 months sober. And a lot has to do with them, even though I've had them a long time, to help me in here to stay strong.
I'd like to see the program grow. If I could get 2 full-time veterinarians, that would be fantastic. And if we could do more of those surgery appointments and do some of the dentals on our own, we could actually provide more service to the county. So I think the program, as it started very small and it continues to grow. So that would be nice. Or even a mobile A mobile vet clinic would be great. If we could put that on the radar and, get a donation or something like that, that would really boost the program.
But I just think of what I'm living for and working for. So I'm grateful.